The Gaza Health Ministry has provided new numbers today, updating the death toll. They now say 40 people have been shot and killed over the last month by IDF snipers during these protests, and more than 440 others shot and wounded. Thousands more have non-bullet wounds. Gaza's health ministry says thousands of men and women have been treated for everything from exposure to tear gas and for smoke inhalation, as well as wounds suffered while trying to escape the gas. Medical supplies in short supply to treat the wounded. There's also a lack of doctors and trained medical staff to help with emergency surgeries and medical treatment. And joining me now in studio is Mor Efrat. Mor is a director here in Israel with the organization Physicians for Human Rights Israel. Thanks for being with us, Mor. Aside from the politics of the march itself and the protests, just in terms of your familiarity with the medical need, I mean, how many doctors or nurses or trained medical personnel are there every Friday to help the people who are shot or wounded? Is it enough?
Well, it's certainly not enough. The Palestinian health system is in a chronic situation of shortage, both of medications and medical supplies for many years now. So you can only imagine what happens now when those thousands of injuries are coming to the Palestinian health system and want to receive care. We see a lot of shortage in basic supplies and instruments, for example, antibiotics. Some of the patients were told to bring their own antibiotics after buying them themselves ahead and then receive treatment in the hospital. There is a problem of sewage thread, for example. Doctors cannot perform surgeries in hospitals.
They can't sew up a wound.
Exactly. Also, they have to be very creative and using a more thick thread, for example. This is something we just heard. Every Thursday, Palestinian hospitals were told to discharge patients from the hospitals in order to have space for the new injured people coming from the demonstrations on Friday. And those people that are discharged are not really ready to be discharged. They're still in need of medical care, but they can't receive it.
From your estimates, I mean, how many doctors are there that can perform life-saving surgery right now in Gaza, and how could you get more there to help?
Actually, the number of doctors, that's not the main problem. There are very good doctors in Gaza. The problem is that they don't have the machine to use, they don't have the equipment, they don't have the medication to give patients. So this is the major challenge now facing the medical system in Gaza.
I mean, we know, sadly, some of these injuries, they were very graphic head wounds, non-survivable wounds from some of these bullets. Are some of these deaths, could they have been stopped if there was better equipment available on site? I mean, do you know for sure that some of these casualties could have been stopped after the fact?
Well, we can only estimate at that point, but we can definitely estimate that if there was a better medical care in Gaza right now, more people could have been saved, and especially when we're talking about a gunshot to the lower part of the body. There are a lot of gunshot towards that part, and people have to get external stabilization in order to save their limbs. And we know in many of the cases that the limbs was not saved because there was not enough medical equipment and the legs had to be amputated. We know about one case of a child, a 12-year-old child, that we were involved in taking him out of Gaza for treatment in Ramallah, that was shot in the leg, and his doctors tried to save his leg. They couldn't, that's why they transferred him to Ramallah in order to save the leg, and it was too late, and yes, they amputated his leg in the end.
Mor Efrat doing important work, and again, keeping us updated just on the medical needs here with these weekly protests. Again, find out more about the organization online, Physicians for Human Rights Israel.